Hello all. Welcome to the fourth episode of Homeopathic Stars of Nagpur. Today I am honored to introduce one of the most remarkable individual, Dr. Ruchi Jain ma'am, whose dedication in homeopathy is truly inspiring. With deep commitment to rules and principles of homeopathy, she has been practicing homeopathy with utmost integrity, and she ensures that her patients receive effective and most compassionate care. Dr. Ruchi Jain ma'am is a MD homeopath from Dr. M.L. Dhavle Homeopathic Institute. Then she was a lecturer in Nagpur Homeopathic Medical College, and then she went on to pursue teachings from her master Dr. Praful Vijayakar sir through the courses of SCPH and SCPH Plus, and then she started practicing homeopathy in Nagpur since 2010. Her contributions in homeopathy are far beyond her practice. She is a beacon of hope and healing to many, providing charitable services to those in need. Also, with the alignment of the vision of her esteemed master Dr. Praful Vijayakar sir, she runs the Hope for Hopeless camp, where she offers hope and healing to those who are suffering from incurable disorders. Also, as a passionate educator, she takes online and offline lectures. She has been invited by many cities for offline seminars, and also she conducts regular online lecture series for nurturing of young homeopaths, like Thursday Sadhana series, which is an online series of predictive homeopathy. She regularly conducts those seminars online for the young homeopaths and for the homeopathic fraternity. So please join me in welcoming Dr. Ruchi Jain ma'am, a true champion of homeopathy.
Hi Priyanka. Hello friends. To all my viewers, this is a very good startup. As you all know, homeopaths need to come to a single sky. That is what is the need of an hour. And since we are technically being updated, so these podcast star shows are going to bring all the homeopathy into one framework. And thanks Priyanka for inviting me and starting such a good venture, which was my vision too, to start such a pathy or such a platform where all homeopaths can come and truly share their feelings and their journey. That will be very inspiring for the upcoming aspirants of homeopathy.
Thank you, ma'am. So let's start, ma'am. As our today's topic is the journey of homeopath, like the vision of a good homeopath. So what will be more inspiring to know what is the journey and of ma'am, like what and how inspired you to pursue homeopathy? What were the challenges you faced in your early practice, and how you stayed dedicated for the field of homeopathy?
I think once you reach the path and you reach your destiny, the journey you have crossed through is just a memory of your past. So similarly, even I started my journey from the stepping stones or the footsteps which we started almost 2000 when I started to pursue homeopathy from Nagpur Homeopathic College. But that was not so easy task. That time everyone would say कि यार why you have to become a homeopath. The value of homeopath was not being considered. But going ahead into life and taking one challenge ahead has really brought so many things into life, and it's a blessing now that though it was not by choice to become a homeopath, but now today seeing me, I think it is a blessing to be a homeopath. And the journey really, it was not so easy, and as you all know, you have to strive through all these struggles, and then only you can come with the shining stars. So whatever you see today, the glamour of homeopathy is because of all these stalwarts of homeopathy who have worked so tirelessly so many years. So even I started my practice that way. So we had to struggle everything, as you know Priyanka, that it is not an easy task for today's world to accept new things. So homeopathy was not that bloomed on those days. But thanks to all our masters who have struggled so much, and I see so many people who have struggled. If I see life story of Hahnemann sir, so we have not struggled so much. But definitely whatever we are today are because of our teachers and the mentors we got at the right time.
So, ma'am, like what inspired you to choose homeopathy?
See, I didn't have any personal experience before of homeopathy, but very honest to you on this platform, that was not by choice, because I got an admission and my mother wanted always to see me as a doctor in a white coat. So I was being selected for homeopathy. Yes, it was not by choice, but today if anyone asks me, it has reached my DNA level and to my Atma level ki yes, I am a homeopath in and out.
And ma'am, we pursue after graduation, then we face many challenges, like what to pursue. We are confused what to do and what not to do. Like we have to earn a lot and then we have to support our families. So, क्या मैम आपके साथ भी ये हुआ था?
Yes, obviously this struggle I think every homeopath has to pass through. Very few homeopaths have got that silver spoon, but we were also struggling for our bread and butter. It was not that easy task for becoming a homeopath and to get successful in life. But yes, when we got the choice, it was really a very hardship. People opted me ki, "Arey, better you join a hospital, you will start your pay scale, you join a research institute or something like that, you will be paid for it." But over a period of time that passed out and blessings were there ki people were with me, my parents supported me a lot, and we chosen to live a very simple life and just live with simple bread and butter rather than going to luxury since beginning. Similarly, I would advise all the homeopaths ki this will come as a side effect, you know. Knowledge will give you money, because if you run behind knowledge, definitely you will get all the glamour ahead in your life. So before, in the starting initial phases, if it's a struggle for you, don't take it as a struggle. This is a test of time and you will definitely pass through.
So, ma'am, what are, according to you, essential qualities for being a good homeopath?
Okay. Priyanka, it's a very hard question to talk on actually, because once you start about qualities of physician as a homeopath, then first thing which I feel is the perseverance, what a homeopath needs, because homeopathy is not something to give you very easy bread and butter, right? So initial phases, yes, it's a struggle and it's a hardship, but over a period of time, every tree which has been sown as a seed, right, and that seed is sown on a soil, or it is sown on the sand, or it is sown on a stone, it depends, right? So we have to prepare ourselves like a good soil, because whatever homeopathy is sowing the seeds upon us, it should bud as a tree, and if it is on the stone, it won't grow, right? So you have to have that quality of like eagerness to study. You have to be very honest. what honesty से ज़्यादा मुझे लगता है perseverance plus hard work and dedication towards homeopathy is the need of hour, and I think homeopaths lack that knowledge because we are not being trained. See, being a homeopath, I think we need a militant training.
Yes.
And I see allied practitioners, the way they are trained, actually it is mesmerizing when I saw them working hard. Right, beginning from the second year, they are put into such a bottle and they are put into that churning of that stone being hammered, that they are, when they bloom up, see, I'll give an example. If you ask your friends, if you have 100 students in the class, you might be having very few homeopaths who are practicing till now.
Yes.
All the females have almost practiced somewhere, but if you see MBBS, you talk to them, hardly you will see a doctor who has got that degree, esteemed, is not practicing in this world. Very few you will count, and we are very unfortunate that homeopaths, very few are working. So that is what I ask my students ki whatever may come be, but you have to dedicate yourself towards homeopathy. Then only you will get those fruits coming to your hand. So first is dedication towards your pathy, that yes, whatever may come, I will practice homeopathy first. That has to come up as a contribution for homeopathy, then a promise that every day we will do it. Every day we have to study, every day we have to give dedication to your patients.
Yes. And ma'am, what other qualities you feel are necessary to practice and be a dedicated homeopath? What qualities you feel?
See, first thing what I find out as a lacune, because I have so many students around me and I have been teaching since almost 13 years.
Yes.
And in this last journey, I was also a student, right?
Yeah.
So when I was a student, when I see myself as a student looking back in 2000 years, 2005 to 2010, that was 10 years of journey being a student of homeopathy. Today I feel I'm still a learner of homeopathy.
Okay.
So you have to be a learner.
Learner.
You have to be dedicated towards the time management.
Yes.
You have to prioritize yourself so that you study so hard, because without hard work nothing pays off. Right?
So the qualities that are essential for good homeopath, according to ma'am, is the dedication towards homeopathy. Whatever struggles may come, but we have to be a dedicated homeopath. And then hard work. Without hard work, nothing is possible. So a hard work and a true learner throughout our life. And ma'am, like what are the common mistakes do you see that mistakes that young homeopaths are making, and how to avoid those mistakes?
Yeah. First thing is, there is no shortcut to success, and I think today's homeopaths, they just want fast success. The second thing is, they are comparing themselves with the other pathies or the other stream of practices, because they see that by the time 24, an engineer has started earning, and whereas we are still struggling for the penny. We start feeling shameful that we are still dependent upon the parents, and we just want something shortcut methods to gain success, and we just move ahead from homeopathy to other practices, and that is what is the biggest mistake. So if you have to be a homeopath from the day one, when you join homeopathy, please dedicate yourself and just decide, I know okay, this will be a hard work and few years will be taken by your hand where you have to struggle a lot. But friends, believe me, I am a very good example, and I have seen so many in this universe, because I will call it as a universe, because whatever you live around is your universe. So I see कि people would tell me before, अरे तू कितना struggle करती है, but today when they find me, I feel I am much settled. And people come and tell me, you are blessed that you are in your own town place, you are with your parents, you are serving your society, and equally a doctor gets that respect in the society, which is not that easy for other people. And we are in our own town place with our own family, right? That is also a blessing. So being a homeopath, just take it as a blessing from the God, and be perseverant and persistent with your work.
Yes, ma'am. And ma'am, for students, like what role does continuous education and self-improvement plays in a homeopath's career?
Yeah. If you call upon a student, first thing what I would say is maintaining your time records, because time punctuality is what takes you off. Students get really confused when I talk to them कि they are not getting the clear vision what they want to see themselves. So the vision clarity has to come first. What they want to pursue in their career. After 2 years, what they want to see themselves as. Right? They are working as a homeopath, they are pursuing their career as homeopath, but the vision is not clear. And as you know, the world is manifesting so fast. So if you have to have that manifestation in life, the vision clarity has to be there.
Okay.
Right? So first thing is the vision clarity, what you want to pursue, what qualities you want to develop will come later on. But the thing is the perseverance for it, and then the dedication, what is wanted. So every time retrospecting your mistakes, what you have committed and where you want to improve, so that every time when you churn yourself in this chisel, then the model comes out. Right? So you have to be prepared first that yes, I have to face their hardship.
And ma'am, many students have this question like nowadays many schools of homeopathy are there. The homeopathy that was practiced by Dr. Hahnemann sir is still there, but many other different approaches have come up. So is this necessary to learn something more specifically other than the classical homeopathy?
See, first thing, yes, I do agree, because there are different school of thoughts which are coming up, and everyone gets attracted towards different pathies and different schools of thought. But since I am a staunch follower, I have got my roots from such teachers, from ICR, I was from MLD MHI, as you know, there the Gurukul Parampara was so staunchly being put into us that we have really shaped ourselves very well. So that was my mother institute, I would say. Then I got a blessing that I was into predictive homeopathy and I met sir in my life. So that was my golden era of my life, that I could learn one-to-one from these legends of homeopathy. So the thing is ki yes, there are different schools of thought and every school of thought is trying to give best to homeopathy. As a learner in the beginning, I would say don't dedicate yourself to one school of thought, but just try to see what is there and then go towards the best pathy. And yes, as predictive homeopath, I know ki we are following all the basic principles being laid down by Hahnemann sir, and I would just tell you ki I haven't learned directly from Hahnemann sir, but whatever sir could teach us, I would see ki he is the living legend who has taught us so well homeopathy. So whatever it is, first clear your basic strengths. Don't run behind you have to follow this school of thought or that school of thought. First, dedicate yourself to get the knowledge of medicine, pathology, anatomy and physiology, because that is the basic requirement of a student as a learner. And once you pass out, then you pursue into yourself कि you are good in pathology, you are good in medicine, or you are good in materia medica. Then you select what you want to. But as a streamline, if I tell you, for materia medica, I read Shankar book, I read Vitholicus, I have read Kent, right? So there are different schools of thoughts, but at the end, homeopathy is what we have to bring about. So basic knowledge of homeopathy is more essential. So go to the readings of Organon. Organon of medicine is Bible. So go and read lesser writings of Hahnemann, read lesser writings of Kent, and really chronic diseases is what the Bible we have in our hand. So please, as a homeopath, if you are at a student level, don't get attracted to all the fallacies of the world, but be grounded to your basic studies.
So ma'am, classical homeopathy, like lesser writings of Dr. Kent, lesser writings of Dr. Hahnemann, we have to study those and then practice homeopathy, what is taught to us in our colleges, and then we should decide that we are good in Matra Medica or we are good in anatomy or physiology, and then we should decide like which school of homeopathy is good for us, because many a times patients also are teacher to us and they gives us the inspiration like what pathy we should practice on them.
Yeah, definitely. It is not only patients who are going to teach to you. See, you have to follow a single method when you are following it, but you should see ki it is a real loyal towards your patients, because you cannot harm the patient just because you want fast results. See, right nowadays there are lot many fevers around. Everyone must be experiencing. I see patients who are coming to us from other homeopaths or from other doctors, and just to get a result, they all are just into fast cure or fast method, but they are really harming the patient by suppressing the disease. So whatever you are doing, please follow Hering's law of cure. Don't leave the classical method, because even Hahnemann sir has said that you have to follow the guiding principles, and everything has to be laid upon the principles which are the cardinal principles of homeopathy, and not the principles laid upon by an individual as a homeopath. So please follow the cardinal principles. You will never waver off from your journey of becoming a good homeopath.
Like ma'am, one student has asked a question like what is your approach in different types of cases with some case examples.
Okay. So when you talk about some cases, like I'll give you an example. Like rightly I said ki fever cases are coming up, right? So I would like to share with you an example. Yesterday what it came up. See, today everyone is talking ki chikungunya is there, lot of dengues are there. So there are specific remedies which are coming up, like everyone is preferring giving you Eupatoria or arsenic or something like that. But yesterday I got a call early morning from a homeopath saying, ma'am, I'm too tired and I have lot many cases to see, and it has been months together, we have not slept. So I'm really very tired now. I have got fever and I'm very sure this is chikungunya. right? So मैंने कहा since when you are sick? So he was like कि since yesterday I'm on bed and my fingers are painful. Even I'm not able to open the bottle and my children are trying to approach me. I want to take them close to me because my daughters are really very attached to me, but I cannot even tolerate the touch of the daughters, right? But I want them to be around me. Then I said, okay, what is the significant thing what you can say? So I knew, because I've seen hundreds of cases of chikungunya right now and I've been treating them so well. So I knew what are the PQRS. So don't leave your cardinal principles, friends. You have to select a PQRS. So I asked him what is significant. So in all the cases, what commonly I was seeing was bitter taste and loss of appetite. And I asked him, did you have your food? Ma'am, yes, I had my food. I had my appetite very well. I want to eat because I know if I eat well, I will go for my practice. So that was the clicking point. This is something PQRS. When all the other patients of chikungunya are falling sick and they are not having that appetite, then this guy is having a good appetite. He wants to eat. So I took the syphilitic rubric because this is a sorosyphilitic disease. The rubric which I entered was appetite during fever. There were only 5 to 6 remedies. One was phosphorus, one was staphylococcus. I asked him, what is the most significant symptom you have? He said more of joint pain. So definitely there was some esteem which was getting hurt, and he was very diligent during the fever also. He wanted to go for practice. He was attending the patient. He was very calm and quiet. And he said I want only is harmony at home, and to maintain that decor of home, I just keep quiet, and I feel I should keep quiet, not express my anger, because it is my responsibility to maintain the harmony. The remedy was clear. Staphylococcus 1M, I told him to take it in the morning. By 5 p.m. he messaged me, ma'am, I'm in the clinic and seeing my patients. So what faster results do you expect?
That is really inspiring, ma'am. Like in nowadays, chikungunya cases have come up, and many of the doctors, they are prescribing eupatorium or arsenic or gelsemium and rust ox, but this approach is something different. Like we have to take in totality the PQRS symptom and the other physical symptoms also, that that gives us a clue about what the nature of patient is. So ma'am, also like you run Hope for Hopeless camp where many incurable cases are treated by you. So ma'am, what is the approach in those cases?
See, when you talk about Hope for Hopeless camps, since these patients are coming with genetic disorders and they are the cases who are with a lot of congenital anomalies coming to us, these cases need to be connected from the mother's womb, because the cause is not beyond that, because it's a machine, right? Mother's womb is a machine who is giving birth to the child. So we are blessed that Vijayka sir has laid down, and we know that there is a connection between mind and body. So we are connecting each and every sensory organ with the thought process which mother has passed on to the child.
Yes.
So during the case taking, we try to connect what is the structural deformity, or it is an intellectual deformity, or it is an intellectual disorder. So connected to the thought of the mother during the womb, which is passed on to the child. So that is what we connect.
Okay. And ma'am, do you see results in incurable diseases?
Yes, there is no doubt. It should not be the question here, because yes, we get so many results, and therefore all over India successfully these camps are being held. I am conducting this camp since 2016 actively every 4 months, and we have so many patients. And to be surprised, I would tell people, go and see and check out my pages. You will see last 2 camps, all the prestigious allopathic doctors have visited our camps, and they have appreciated the work, the meticulous work we are doing. And he said, I would not, I feel esteemed to take his name, Dr. Satish Devpujari sir. He is a leading pediatrician of Nagpur, and on the same place he said that this is God's work, and Dr. Ruchi, you are doing a fantastic job. And I would just thanks Dr. Praful Vijayka sir, that who has brought this vision to us, yes, we can bring hopes to those cases who are really incurable.
Ma'am, predictive homeopathy is the only school I feel that is curing the incurable and genetic disorders.
Yes, Definitely, Priyanka, you're very right. I have seen other schools of thought, but sir would never say ki you just have to work harder. As per the need of art, you have to apply the totality. Sir has brought homeopathy as mathematics, and he has laid down all the principles you have to follow. It is soric, it is psychotic, or it is syphilitic. You have to just apply the formulas over there, right? And once you apply the formula, you get all the results at your doorstep.
So, ma'am, like we both are from Dr. M.L. Dhable Homeopathic Institute. I was in the psychiatric field. I have seen their cases improving with homeopathy. So, what is your experience in treating mental disorders with predictive homeopathy?
Priyanka, I knew you, but I knew only that you are from ICR, and therefore I got connected immediately to you because we belong to the same maternal institute, as I said. Yes, in ICR also, that is the place where I felt that homeopathy has got such a level high, and I was blessed to be a part of the institute, and I learned so many things from my masters over there, and they are still my teachers, they are still my mentors. Even if I am following predictive homeopathy, I have not left my roots over there, and I still connected, and I saw the results over there, and today also I see the results over here in psychiatric cases. I will share one of my very recent case with you where the patient was very delirious, and she had bladder cystitis, a very chronic cystitis, where she had got lot of disorders at that level, and because of fibrosis there was kinking at the bladder level, and retention of urine is very high. She is with catheter since almost 5 years, right? So when she was with that catheter, the patient said ki she is suddenly developing some visions, right? And she has started saying कि मेरे body में कीड़े चल रहे हैं, तुम लोग सफाई नहीं करते, and there is lot of ants crawling on the floor. So this is what delusion and deliriums are, right?
Yeah.
So when I saw the delusions, I was like, "Arey, why she is having this?" So first initially, it just missed my mind. But then, as per teachings of predictive homeopathy, sir had said that when you are treating chronic diseases and when you start seeing some mental symptoms like change in the psyche of the patient, then definitely they are the delusions. And there is a single remedy which has got UTI, which is connected to so many delusions and deliriums, and I gave her cannabis sativa, and within 24 hours all the ants and spiders were gone, and my to the surprise, that patient's daughter-in-law called me, "Ma'am, पूरे घर की सफाई होगी, अब आंटी को कहीं पर भी कीड़े नहीं दिखते."
That is very inspiring, that mental health disorders are treated very well in homeopathy. I also feel very surprised. In my OPD also I see many psychiatric cases, but I wanted to ask Ruchi Jain ma'am what is her approach, so I asked this question. And ma'am, what are your thoughts on the future of homeopathy? Like, what do you hope to see in the next generation of homeopathy?
That is my vision, that is my dream, and I think all the homeopaths who have worked so hard and tirelessly all these years definitely want to see homeopathy as the upcoming stream, and not the homeopaths being selected as a compulsion, but homeopathy should come to the level of IIT, that people come to us by choice and bring this divine level of science to that level, that yes, this is the best practice we can have in our life.
And ma'am, what qualities do you see in future homeopaths, like to reach that benchmark of homeopathy that you have created?
Again, the same question, but definitely a different answer. What you want in future? Yes. See, roots are roots. You cannot leave your roots and go away, and we are human beings. Everything has to come step forward. In homeopathy, there will be no one night success or no glamour which will come one night. Yes, you have to be persistent and hardworking with your clear vision. And since you have connected to the future, and I am spiritually connected, I am into meditations and also I can understand that the world is just expanding and manifestations are happening very fast. So if you are people of today's generation and you have to manifest your dreams very fast, so bring the future clarity. The vision should be clear in your vision board that yes, this is what you want from your life, and you have to dedicate yourself towards that vision. Every day you have to manifest one step ahead to your goal.
Ma'am, would you like to tell us something about your online lecture series and the seminars that you take?
Yes, I was very fortunate to have Praful Vijaykar sir, but very unfortunate that I never thought ki in this lifetime I would miss him so badly. And we started conducting sadhana series lecture as a dedication or devotion towards Dr. Praful Vijaykar sir, because it was his dream that a right homeopathy should reach all the homeopaths. And since we miss him each day, his teachings I used to conduct every Thursday. Then thereafter, every month, last Thursday, I am taking sadhana series online lectures, which are really free of cost. I take offline lectures for my students every week. There are 3 lectures. Every Tuesday, Thursday and Saturday, they are in the morning hours, and I see to it that they do all the homework along with the presentations. They are also taking the presentation and they give exams also. So that is what I expect from my students.
Okay. And ma'am, like what is your advice to someone who is just starting their homeopathic journey?
If you want to become a successful homeopath, first become a true learner and an ardent student who is ready to devote his life towards homeopathy. And that priority to being a student of homeopathy really needs a military training, that I said before also. So you have to give at least 15 hours of your life every day to homeopathy.
And ma'am, some books according to you which homeopaths should and always keep with themselves and they should use that in their practice?
Yes. First is definitely your Organon of Medicine. Every time I read it and I unreveal one thing which has not been seen by me before. Organon of Medicine is something which has to be taken it to your DNA level, I should say. Allen's keynote, yes, for a basic homeopath. Boric, Bonninghausen, yes. So all these basic books are very essential. If your organon is very good, you will practice very well. And definitely books of all your stalwarts. You read materia medica from different resources, but repertory is something which has to be kept with you. But before you become a homeopath, become a good physician. So organize yourself with good clinical knowledge and medicine, pathology. I'll tell you, Priyanka, if you just see behind you, you will see pathology, physiology books and anatomy books that I read every day. And I read medicine.
Okay.
Okay?
So this was Dr. Ruchi Jain ma'am. She is very disciplined doctor. Like when I met her, I was a little bit afraid, like how will I approach her? But now through her warmth, through a warmth of nature, I feel very comfortable with her. So that is her nature. She is truly a dedicated homeopath and she is helping others through many platforms. So I request you to please visit her clinic at Mahal Badkas Chowk in Nagpur, and you must always see that she is truly practicing homeopathy in the rules that Dr. Henneman has advised us to. So thank you, Dr. Ruchi Jain ma'am, for being with us.
Thank you, Priyanka. I am a person who preaches what I practice. So whatever I have talked, I have been a classical homeopath. We take all the pressure कि our cases are being properly evaluated. We take proper case taking. So whatever we are teaching through our platform, everything is being practiced in our place. Yes, every homeopath is welcomed over here. Yes, I am a disciplined person, so I cannot tolerate all those nuisances, definitely. So don't get afraid of approaching me. If you're dedicated towards homeopathy, this will be the best place for you to learn predictive homeopathy. That will really take to you higher. And if you want to pursue MD, then ICR से best कोई place नहीं है. on this world to complete your MD medicine or MD in any faculty of homeopathy, because that is where you get true mentorship and the Gurukul Parampara. And definitely predictive homeopathy will sharpen your tools ahead and you will be a successful homeopath. Thank you.
Thank you. Thank you, ma'am.